So once again, Centers for Disease Control has changed its guidance on masks and COVID. The CDC now says, announcing today, all Americans, including those who are fully vaccinated, should wear a mask inside of areas with high transmission of the virus, which, according to the CDC Community Transmission Map, which highlights areas of high transmission in red, appears to be a whole big swath of the country. To help explain this change in policy, I'm joined by Dr. Anthony Fauci, Director of National Institute of Allergy and Infectious Diseases and Chief Medical Advisor to President Joe Biden. Dr. Fauci, Dr. Walensky was saying that at the announcement today that this was based on data they've been collecting sort of in real time about Delta variant transmission. So what's the data, and what about the data pushes towards this as the policy recommendation?
Okay, there are two aspects, Chris. One, we know that the Delta variant is considerably more efficient in transmitting from person to person than the original Alpha variant that we have been dealing with. Number one, the Delta variant is the totally dominant variant now in this country, more than 85%, and in some regions 90+%. But even more importantly, it is clear now that when there are breakthrough infections, namely people who are vaccinated but still get infected with the Delta variant, which happens because no vaccine is 100% effective. Mm-hmm. We've learned clearly now, without a doubt, that people who are vaccinated get a breakthrough infection, actually have enough virus in their nasopharynx that they can actually transmit it to other people and have documented transmitted to other people. So because of that, the virus has really changed, and that has really triggered the change in the CDC guidelines. So right now, the way you correctly said, that even if you are vaccinated, you need to wear a mask in indoor public settings in the areas that have a high degree of transmissibility, namely the orange and red areas of the CDC designation.
So when we spoke about the decision by the CDC to say you didn't have to mask indoors if you were vaccinated, the key driver there was data about virus transmission amongst those folks vaccinated. And you were on the program, and there was a little bit of a question. We knew that in the testing for the clinical trials and then in real world testing, this was doing a very good job of preventing severe illness and hospitalization. There was more question about whether you had viral load to transmit. The data came back saying you don't really, and that it's okay to be indoors. Right. Now, I guess the data is just different with Delta, but do you understand why people might feel a little whipsawed between the last announcement and this one?
Yeah, it's thoroughly understandable, but there really is a pretty clear explanation of it. And here are the data. When you go back 60 days or the 2 months ago, when you look at the level of virus in the nasopharynx of a person who's vaccinated and gets a breakthrough infection, it was considerably less than the level of virus in the nasopharynx of an unvaccinated person. The data were clear. Now that we have a Delta variant, that has changed the entire landscape, because when you look at the level of virus in the nasopharynx of a vaccinated person who gets a breakthrough infection with Delta, it is exactly the same as the level of virus in an unvaccinated person who's infected. That's the problem. So those data are very compelling, and that triggered the change in the CDC guideline.
That is fascinating to me, because I know basically nothing about medicine, but I guess my intuition would be that the viral load would correlate to severity of illness. And what I'm hearing from you is that, like, you've got a situation in which Delta is producing a higher viral load and higher viral load shedding by orders of magnitude, if the data we have is to be believed, and yet not leading to severe illness in the way that you would fear, right? That the big fear was that you'd have that it would essentially evade the vaccine.
Right. Chris, you nailed it, because that's exactly what it is. That the antibody response, the immune response that your body makes that needs to block virus in the upper airway needs to be much more powerful than the immune response that protects your lungs. In other words, you need a lower level of protection. The lung is more easily protected than the upper airway.
Right.
We know that from animal studies. It's very, very clear.
So I guess the last point here is, do you feel like there's a kind of meta-communicative point to make here, which is this stuff's going to change. Like, this is a fairly dynamic situation and is going to continue to be. It's not like we're going to just kind of turn the page on coronavirus, because there might be new variants and there might be different seasonalities, and that's going to be part of life.
Well, Chris, it doesn't have to be if the overwhelming majority of the people in this country get vaccinated. We could nail this down by just crushing it. The problem we have, Chris, that you and I have discussed multiple times on your program, right now, we have 100 million people in the United States who are eligible, who are not getting vaccinated. That's the problem.